Howdy, the name's Johnny Ray, and for this video, I'm going to be talking about the treatment for MPS II. The main points I'm going to go over are what the treatment is, my experience with it, and advice on setting it up. So, what's the treatment? Since there is no cure for MPS II, you have to go through a treatment called enzyme replacement therapy or ERT, and this treatment has to be done every week using a drug called elaprase. The elaprase is what will help break down the sugar molecules that are built up in our bodies, and it'll slow down the progression of the MPS and improve quality of life. I've been doing this treatment since I was 10 years old now, which is crazy to think about because that's almost been 20 years now. In the booklet, it mentions that the treatment is infused by IV. I'm sure most other people with MPS have this, but just in case, for my infusions, I am infused through a porticast that's in my chest here instead of doing an arm IV. That way I don't have to worry about getting poked in the arm every week or having to go through several pokes because sometimes nurses can't find a vein with my skin. With the port, it's kind of like a X marks the spot kind of thing because it's just one easy spot to access for the nurses. Like I said before, I was only 10 years old whenever I started doing these, so I was definitely scared, but then I got used to it after a few years. I did start out with a numbing cream, but I eventually stopped that too. Nowadays, I don't even feel the needle go in, but I can feel whether or not they access the port correctly or not. It's weird because I feel a click when they hit the spot, or when they mess up, it's like a stinging pain. When I first started doing these infusions, I was going to the hospital for 4 hours and just sitting there with doing whatever I brought with me. It was mainly homework because I would procrastinate on that. Ever since I moved a few years ago, though, I've been doing my infusions at home, which is much more comfortable. And now they are only a couple hours long, which I'm not really sure what determined the shortening of the infusion. I did try to get set up at hospitals whenever I moved, but the two or three that my doctor tried to help me get into, they denied to do my services. All of them said the same thing, saying that they didn't know anything about MPS or the drug, and they didn't want to risk it financially, saying I would be a liability or something along that line. When I got that news, it pissed me off because I hadn't had my infusion in 3 weeks. Because of those denials, I ended up just going straight to home infusions. Thinking back on it though, I'm kind of glad that I was able to get set up with home infusions since it's just much more comfortable. The missing 3 weeks of infusions leads me to my next point though, which is side effects. Sometimes after an infusion, I experience side effects like tiredness and slightly achy joints, but I can get through that with a short nap. Now, in the very rare case after an infusion, or whenever I miss 3+ weeks of infusions, I get extremely ill. These side effects range from fever, chills, hurting to move, and it usually lasts about 6 to 10 hours. That's what happens after the infusion. Now here's the side effects of just missing my infusion. I've had to miss infusions for several reasons, whether it be pharmacy mess up or insurance mess up or any other reason that may come up. Fortunately, I don't feel anything until about the 2.5 week mark. After this point though, I definitely feel a difference in my body. I feel much weaker, it's harder to move, and it hurts to move, and I just feel sick most of the time. Luckily, during the most recent situations that I've had, the company that helps me manage my infusions has provided emergency medication. This kind of leads into the final point of setting up the infusions. Now, setting up the treatment initially, I am not completely sure of doing since I was just a kid whenever I first started doing this. I just want to help out anybody that may have a child with MPS that needs help setting this up and maybe point them in the right direction. With that, I believe the most important part of the setup is the MPS diagnosis. Once you have this, keep track of this for whenever you move or have to change insurance. When I had to change insurance and doctors at the same time, I didn't know where my diagnosis was, so I had to go through that process. Luckily, it's just a simple blood lab exam that you have to do. At least it was for me. After you get your diagnosis, you can reach out to the MPS Society, who probably have all the resources for companies to help you set up and manage the care that you need. The company that I've been with, they've been pretty amazing with helping me, especially whenever I first started taking over my own care. They've helped me with so many issues like insurance, billing, and setting up the infusions when insurance decided to be annoying, which is another topic for another video. After you get set up with a company, they can help you find a pharmacy that handles the drug, which will probably affect how you receive the treatment, whether it be home infusions or in a hospital. Then the last part should just be setting up your treatment location, and you should be good to go. Just be prepared for some fights with insurance because the drug and infusions are not cheap, and insurance will try to find a way for you to pay more for it. Like I said, insurance will be another video because I will also talk about how you can get help to take care of the copays. I think that's going to wrap it up for this video. If you have any questions, go ahead and leave them down in the comments and I'll get to them as soon as I can. Take care and see you later.